Hi, this is Dr. Paul with CarInjuryCare.tv, and I'm talking with Dr. Nick Venturino here in North Tampa. And we cover the common questions about regarding automobile accident injuries, medical and legal. And what we're talking about today are some common questions your doctor should know about automobile accident injuries. So let's talk about a few of those, if you don't mind, Dr. Venturino. And specifically, what are some of the common aspects that a doctor should know if he's going to be working with personal injury, automobile accident injuries? What would you say some of them that a doctor should know?
Number one, they should have some experience in treating traumatic injuries. A lot of doctors don't have that experience. They're used to treating mostly in a family setting, so they don't see that type of problem, so they don't have a lot of experience, and typically they're more timid about treating it, and obviously don't have all of the skills necessary to document that type of an injury.
So a doctor that specifically treats physical injuries would be definitely one.
Absolutely.
What you're saying. What about any certification relative to what's called the AMA guides?
Again, the AMA guides are the absolute end-all be-all for how you measure how much damage has been done and how you document that damage so that it's viable in a court of law. So it's obviously better if you have a doctor that's trained in how to use the AMA guides to impairment, because they're much more apt to use it correctly versus just trying to wing it and come up with a magic number that could be pretty easy to tear up in court by somebody who didn't know what they were doing.
So it sounds like a doctor should know how to use what's called the AMA impairment guides.
Absolutely necessary.
Now, do you use the AMA impairment guides?
Yes.
Okay. What about if the doctor is willing to testify in court for the patient? How important is that?
I think it's very important to be willing to do that. I'm not an attorney, but I would assume if you weren't willing to testify in court, that's got to have a negative light on your ability to manage and evaluate a case. So I would think it would diminish the doctor's credibility if they weren't capable or refused to get in court and testify under oath that this is what I know, I'm trained in doing this, I'm very good at it, and you can respect what I've come up with, versus the fact that I say it's all there, but I don't want to go to court and have to be.
So I guess if a doctor's not willing to go to court to testify on your behalf for your injury, is it fair to say that that could actually hurt you?
I believe so.
Now, are you willing to go to court for your patients?
Absolutely.
Okay. And what about the types of doctors that you would use? Are there certain types of doctors that you would use to help manage a case that's an automobile accident patient?
Yes, we would use orthopedic and neurological surgeons where necessary, orthopedic spine surgeons and neurosurgeons where necessary, orthopedic surgeons for joints, neurologists for head-type traumas, physiatrists for helping to corroborate problems with movement. So we have a very specific group of attorneys, of physicians that are very specific to a patient's type of problem, and they help corroborate that this is actually a problem, but also they're suited to, if it needs further treatment, something that for example I couldn't do, like surgery, they're the type of doctor that would be able to assess that and then do it if necessary.
And I take it you have a handful of doctors you work with specifically to help with auto accident cases?
Absolutely, doctors that are very, very used to treating auto injuries, and also are okay with testifying in court, and also have a great reputation as somebody who testifies in court, specifically because of their knowledge and skills.
And what should some of the common diagnostic tests the doctors be used to using to help in an automobile accident case?
Obviously X-ray, but they should also be using MRIs or CT scans depending upon the patient. They should be using nerve conduction velocity studies where necessary. Digital motion X-rays can be very valuable. in certain cases. So it's specific to the patient and their problem, but those 4 or 5 tests are going to fit most patients that come into an office from an auto accident.
Now, do you have access to those tests?
I don't do any of them in my facility, but I absolutely have access to those, and we can refer our patients out for those.
So
We
if
do
a
that all the
patient,
time.
so if a patient needs any of those tests, you can get them done?
Absolutely.
Okay, okay. And what would you suggest, anything else in regards to what a potential patient should pick in regards to a doctor that he should be aware of or know relative to an automobile accident case? Because they are a little different, aren't they? There's little different rules with automobile accidents. The legal part's a little different.
I think you'll find if you just call your primary, oftentimes you'll find that your primary doesn't want to do anything with an auto case because they don't have the training or the education to deal with those types of injuries. So sometimes it takes that question right out of your hand. You call and they say, we don't want anything to do with it. Go to
I've
somebody
heard
else.
that before. Is that the reason? Is that the reason that general practitioners generally do not like treating automobile accident cases because they don't deal with physical injuries?
Exactly. I have several primary care physicians who, they're family practice. They're great with colds and flus and infections and so forth, but they don't, they understand. They have no education, no training in physical injury, so they refer that type of stuff to a physical injury expert, you know, a doctor who's that's what they deal with.
Yeah, I have heard that. So essentially what I'm hearing in summary is when you pick a doctor to help treat your automobile accident case is that he has some knowledge in physical medicine, 1. 2 is he has access to the different tests if needed.
Absolutely.
3 is he definitely knows how to use the MA impairment guides.
Yes.
Anything else you can think of? Have you ever referred a patient to another doctor and that other doctor actually hurt or inhibit or hinder that patient because of their inadequacies? Can you think of anything offhand? Not offhand?
No.
No.
No,
Have you ever dealt with a doctor, another doctor who that doesn't do impairment? Besides, you said GPs. You said GPs don't like doing physical medicine type
Correct.
stuff. So.
I try to do a very thorough research of the doctors that I work with. 1, by finding out how good or the quality of their skills as a physician, but also I talk to a lot of attorneys and say, how are, you know, here's Dr. X. How do they do? Have you ever encountered them in a case? And how do they do when they're put in front of a jury? Or how do they do with their reports? Do the reports help you or hinder you? You know, so there are a lot of research goes into who I specifically work with the idea that you know I only try to work with people who are going to help build cases in as positive a manner as possible. 1, they can help you get to the next level of health, but 2, they can document and corroborate what's found so that it builds your case as much as possible.
Yeah, I don't know if the average person is aware of some of these specialties, you know, relative, because I think most people think they can just go to their GP or the emergency room and they're taken care of.
And I see that a lot where they go to the emergency room and they're told, well, you don't have any break, no fractures, you're okay, it'll heal in a week or 2, and you know, take some pills and good luck. And you know, those people that follow that advice typically wind up with chronic problems down the road from abnormal healing versus the ones that go, well, I don't feel better, I've got to investigate this further and go get some sort of treatment.
That makes sense.
That's physical.
That makes sense. Okay, good. All right. Again, this is Dr. Paul with Car Injury Care TV, and again, Dr. Venturino has produced over 50 videos of common car injury questions and answers. And if you've been in an automobile accident or a friend or family member has, it'll certainly help you out.